Hello, this is Dr. Scott Kilberg, the Video Foot Doc, here with another video for you on all things foot and ankle. Today I'm going to talk about metatarsal fractures. Now, metatarsal fractures are some of the most common fractures that we see in the foot. The metatarsal bones are basically the bones that comprise most of the middle of your foot, going from the beginning of the middle of the foot all the way to the ball of the foot where the toes begin. Now, there are 5 metatarsal bones, and these correspond with each of the 5 toes. Now, metatarsal bones are long bones that are roughly drumstick shaped, and they can get fractured through a wide variety of different means. Metatarsal fractures can occur in groups, or just one of the metatarsals can become fractured. And this all depends on the pattern of the injury, where it occurred, and actually the pattern of the fracture can also vary too. Sometimes they're just simply cracked partially across the metatarsal. Other times the metatarsal is crushed, or it's broken so much that the two pieces separate. I'll start with a general description of metatarsal fractures, kind of going bone to bone. As I said, there are 5 metatarsal fractures, there are 5 metatarsals, and each of them can become fractured in some different way. The first metatarsal is a very thick metatarsal. It's the thickest one, and it basically is the bone that corresponds with the big toe. The end of the first metatarsal, also known as the metatarsal head, is what basically forms the big toe joint, and then that metatarsal bone goes all the way back towards the middle of the foot. Now, this bone is a little bit harder to break than the other bones, just because it's very thick and very stocky. You have to have a very specific force applied to the middle part of the foot in order for the first metatarsal to be fractured, but this can certainly occur. The metatarsal can fracture almost anywhere along its length, including up by the head of the bone or out towards the base of the bone itself. Looking at a bone model, this being the big toe, this is the first metatarsal, and up by the top here is the head, and here is the base. And as I said, this bone can fracture almost anywhere along its length. Now, typically when the first metatarsal fractures, because of the importance of the first metatarsal with how you bear weight, it's relatively unstable. And metatarsal fractures of the first metatarsal need to be repaired surgically in most instances because of this instability. Often this requires hardware to basically put the pieces back together. Now, usually when there's enough force to break this bone, there's also enough force to cause some crushing of the bone itself. So sometimes these fractures can be somewhat complicated to repair and aren't just 1 or 2 pieces that need to be put back together. Moving on to the next set of metatarsals that are commonly broken is the second, third, and fourth metatarsals, which can correspond with the second, third, and fourth toes. Now, these metatarsals are the ones that are most commonly fractured, and there can be lots of different reasons for it. You can have a crush injury where something can crush down on the top of the foot itself and fracture these bones. There can be a significant force being applied to the ball of the foot, which can cause these bones to fracture. And there even can be a lot of non-trauma type scenarios that can develop in which a stress fracture can form because of repetitive micro-injury to the bone itself. Now, some of the more common patterns for fractures in the second, third, and fourth metatarsals are going to be at the head or the neck of the metatarsal, and sometimes in the middle of the shaft as well. Often these fractures are sort of diagonally across or sometimes straight across, and a lot of times they don't necessarily displace or move apart the 2 pieces that are fractured, but occasionally that does occur. Now, in a lot of scenarios, these metatarsal fractures of the second, third, and fourth metatarsals can be treated simply with immobilization, either in a walking boot or in casting crutches, as long as the 2 pieces aren't too separated. Sometimes emergency rooms will put people into what's called a post-operative shoe or a hard-soled sandal, and unfortunately, in my opinion, I don't think that's good enough in order to stabilize and support the metatarsals. The reason being is that the second, third, and fourth metatarsals, while not bearing as much weight as the first and fifth metatarsal for a lot of people in their foot structure, still have a very important role. And if that metatarsal is allowed to deform as a result of the fracture and the movement of that fracture fragment out of place, the resulting change in the pressure across the ball of the foot can potentially lead to pain and inflammation, as well as production of a callus in certain spots across the ball of the foot because that pressure point has changed. And that can lead to other future issues, including pain, discomfort, and sometimes can lead to skin wounds and other types of more serious skin issues in patients who, for instance, are diabetic. So it is important to maintain the proper alignment of these metatarsal heads when there is a fracture near the metatarsal head or the neck level of the metatarsal. And so therefore a little bit better mobilization is necessary in order to keep that stable. Now if there has been separation of the fragment, surgery is necessary in order to repair that because, as I said, that proper alignment is so very important and needs to be maintained. Now the last metatarsal that can become fractured, before I get into that, going back to the second, third, and fourth metatarsals, there is another fracture pattern that can occur further back towards the base of those bones, which would be more towards the middle of the foot down in this region here. In this region we often see stress fractures form. Now stress fractures can form right in the middle of the bone itself, but more often than not I typically see it at the base of the bone. And as I said, a stress fracture is sort of a repetitive micro injury that occurs, not so much because a specific injury has happened, but just a repetitive type of activity. Sometimes that can be as simple as somebody who operates a pedal for a very long period of time, or has to jump up and down on pallets, or some other type of activity that creates a lot of strain to this part of the foot. And over time the bone can become microfractured, not so much that there's a solid crack through it, but the bone itself is damaged. And this is called a stress fracture. And these take a little while to heal. It's almost faster for a traditional fracture to heal than it is a stress fracture, which simply takes time to mend, sometimes 2 or 3 months with mobilization. As I said, a lot of times they can occur at the base of the bones, but they can also occur within the middle of the bone itself, or even at the top of the head of the bone, but I don't see that as frequently. Now the final metatarsal that I'm going to talk about is the fifth metatarsal. Now the fifth metatarsal is somewhat unique because the fifth metatarsal is much more mobile than the other metatarsals are as far as how it functions. This has to do with the way that you have to walk and the way your foot has to roll out through the motion of walking. And so this part of this body is going to be more mobile. And so there's less stability of the metatarsal at this region. Fifth metatarsal fractures, like the other ones, can occur at any spot, including at the head and neck of the bone, in the middle of the shaft, and they can also occur at the base of the bone itself. There are a couple different kinds of fractures, though, that can occur at the base, and those are the most common type of fifth metatarsal fractures that we see is at the region of the base of this bone, which basically corresponds with this section of bone right here. Now, the most common type is a fracture through part of the base called a Jones fracture. Now, a Jones fracture is very common. It occurs in sort of a diagonal manner through the shaft of the base of this bone, and can be quite unstable, unfortunately, due to the fact that there is a lot of instability of the fifth metatarsal itself. More times than not, Jones fractures have to be repaired with surgery, basically a screw that gets placed through the fracture and through much of the bone in order to keep it stabilized. This is definitely necessary in athletes because the healing time for a Jones fracture is way too long to tolerate for a decent recovery, but also can occur in many other people. Some people who are not good surgical candidates will have to have this fracture repaired the old-fashioned way with casts and crutches. And in a lot of cases that does work, but once again, this is a very unstable bone, and sometimes it simply doesn't heal very well, and surgery really is needed in a lot of these cases to fix this fracture. Now there is one more type of fracture that can occur at the base of the fifth metatarsal that is often mistaken for a Jones fracture, but it's technically not a Jones fracture. Looking at the bone right here, there's this prominence that occurs on the outer flare of this fifth metatarsal, and there's a tendon that attaches to this particular flare. This is called a styloid process, and the tendon that attaches to that is the peroneus brevis tendon. Well, in certain injuries in which the foot is rolled inward, much in the same pattern as an ankle sprain, and sometimes even occurring with an ankle sprain, there can be enough force on that rotation that the tendon that's attached to that, if it's actively trying to pull and stabilize the foot, will actually rip off a piece of the bone. And so it's a much smaller piece that gets ripped off, but it's a fracture nonetheless. And if it is big enough, it can be repaired back down onto the bone itself. If it's not big enough, then the actual fragment may need to be removed, and the tendon needs to be repaired back onto the bone itself. Now, if that tearing and that ripping has occurred and the bone is fractured, but it hasn't necessarily moved anywhere, then sometimes a mobilization in a cast, or even sometimes a walking boot, can be good enough to allow that bone to basically seal and heal back down onto itself. But this fracture, unfortunately, is often referred to as a Jones fracture, even though it truly isn't a Jones fracture, which is a different type of fracture that occurs a little bit further on up the bone at this level right here. Once again, metatarsal fractures can come in a wide variety of different shapes and patterns, and the treatment really does need to be tailored around specifically treating the fracture that has occurred. The first and fifth metatarsal bones do have fractures that need a little bit more care and more often than not surgery to repair the fracture than the second, third, and fourth metatarsals. However, those do sometimes require surgical intervention, especially if there's been a lot of displacement of the actual fracture fragments themselves. Proper treatment is very important in order to maintain the proper alignment of the bones in the foot and to prevent future issues from developing. Well, I hope you enjoyed this video. Please look for more videos on all things foot and ankle on this site as well as others, or you may check out my website at www.inpodiatrygroup.com. Thank you.